Time now for Restoring the Soul of Healthcare from the HELPcare Clinic in Austin.
It is that time for our once-a-month get-together with our friends from the HELPcare Clinic here in Austin. Lee Aase and Dr. David Strobel joining us today. Good morning.
Good morning, John.
Hey, great to be with you, John.
This is an interesting time of year. As I know, we've rolled around on the calendar to open enrollment, and it's a great time really to kind of go through the HELPcare Clinic and talk about ways that you believe you can save people money. And we're also going to talk about your brochure a little bit, because I was scrolling through it today, and it's actually a beautiful put together pamphlet, but lots of great information in there.
Yeah, well, thanks. I mean, open enrollment is that time, November 1st to November 15th, when people who have employment-based health insurance typically have a choice in terms of which plans they're going to pick, whether it's a higher deductible or a lower deductible. And of course, there are different costs associated with that. If you have a higher deductible, you're going to pay lower monthly premiums or with each paycheck. And if you have a lower deductible, it's going to be higher. And so as people are thinking about their health care for next year, one of the things that we're suggesting to folks is that as they're considering, membership at HELPcare Clinic, that might give them the confidence that they could say, I could maybe take that higher deductible plan because it's likely I'm going to be able to get most of my care at HELPcare Clinic at no cost. That you pay for the monthly membership or the annual membership, and then there's no charge for the lab tests or the office visits or first couple prescription medications. And so with that kind of big package part of the cost out of the way, people then they need to take make the assessment of, so how likely am I to need to end up in the hospital, or and can I afford it if I need to? Like, is it better for me to take that savings on my premiums and maybe put it toward the membership so I actually am getting the care? So that's part of the reason we developed that booklet, that you mentioned, called Saving Through Membership, because it kind of talks through how the HELPcare Clinic model works and then how it relates to your insurance choices.
Kind of how it all dovetails together, because even as you were describing it, that a lot of employers may have a health savings plan that you can have money put aside so that if something catastrophic were to happen, you still have ability to take care of some of those things. And there's ways that really options that can make it work for just about anybody.
Yeah, there really are. Yeah, I mean, because the reality is that whatever health plan you have has some kind of deductible. Okay, mm-hmm. You're going to have some first part of it that you're going to pay for. And what we're suggesting to folks is that if they get a membership at HELPcare Clinic, while this doesn't count against your deductible because we don't participate directly in the insurance system, it is a way of kind of knocking out most of the expenses most people are going to have for a fixed amount that's dependable, that they can budget. And then hopefully we're going to do everything we can to help them not need to use other healthcare services, so it can be more affordable for them.
Yeah. I think that there's a real tendency for people to see their deductible, look at their bank account, and then avoid medical care. And of course, for many things, that means that whatever is wrong can get wronger, so to speak, and eventually, some bad thing happens that requires them to use an expensive healthcare system. And if they had the ability to focus on the prevention stuff, there's a decent chance, at least, that we would reduce that likelihood that they'd have these big expenses that are unexpected because of unmanaged problems.
Yeah, in a way, I was just thinking, it's like letting your house deteriorate to the point where you have to do a major construction project. You'd be better off taking care of the little things as you go.
Yeah, that little engine light on your dashboard of your car, that's not what you use to figure out when to do the oil change.
Very true. And talking about, people looking at this brochure, getting information, we do want to talk too. You've got a couple of open houses that are coming up fairly soon that you really want people to come and say, hey, this sounds intriguing, but I've got questions, and they can get them answered.
Yeah, that's why we scheduled the open enrollment open houses. And in fact, there's one tonight here at HELPcare Clinic in Austin. So we're doing it in Austin on Thursdays and in Rochester on Tuesday. So Tuesday the 7th will be the one that we're doing over in Rochester, but then we're doing both this Thursday night from 5 to 8 and next Thursday night from 5 to 8 here in Austin. Yeah, the basic idea is they can come get a tour. We'll be able to show them around. They'll see what the clinic's all about and how it works, and then have an opportunity, if they bring their open enrollment materials with them, we can kind of sit down with them and explain some of the implications and where a HELPcare Clinic membership might be able to take care of a good chunk of the care that they're likely to need. And then they have to make the decision in terms of what that means for which product they might take if they've got a choice. But at any rate, they'll be more informed about it and be able to make a good decision.
Yeah, really letting them know the best way to make this work for them and keep them on a healthier path. But through the course of these conversations we've had, you've had even some of your members talk about how getting into the program and being a member and really learning about how they can be proactive in their healthcare and what they do on a day-to-day basis, that they've been able to reduce medications, change the way they feel, the way they live, that save them money all the way along, because suddenly they're not having to do things that they were previously.
Right. And the current healthcare system really makes people dependent upon practitioners and medicines. And what we're trying to do is kind of turn that paradigm upside down so that people realize they're in charge of their own health. And when they get good information, boy, they can take that ball and run clear of the end zone, with very little need for medical intervention. And that just has happened over and over and over here, many times extremely dramatically.
Yeah, I'd encourage folks to go to our website at helpcare.health. And if they look in the menu bar where it says blog post, there's a member stories drop down. And there's about 25 of our members who've told their stories. And, there are various kinds of things from, I've turned my health around and, significant weight loss and really improved reducing medications. And other people just talking about the experience and how they really appreciate the time that they get with our practitioners, and that they really feel like they know their doctor and their doctor knows them.
Yeah, it's one of those deals where, and we've talked about it before, where knowledge is power. And I think oftentimes I've felt like the doctor is going to fix whatever the problem is, but maybe a better approach would be going, let's see what's causing the problem and see if we can correct that and not get here in the first place.
Yeah, that's exactly right. That's the principle behind what is being referred to as functional medicine. Mm-hmm. And none of us here as practitioners are certified as functional medicine practitioners, but we all have a very big interest in that, and each of us has done some learning in that regard, and more to come later on. But that's the idea: is let's work on looking for root causes, fixing that kind of stuff. And it's amazing how many times we've just helped people to make lifestyle changes, and so many things became unnecessary to treat medically, or much less necessary to treat medically.
Yeah, absolutely. We got just under a minute. Let's quick remind people about the open houses and where they can find you and get more information.
Yeah, so the open house today, November 2nd, from 5 to 8 p.m. At HELPcare Clinic in Austin. That's at 308 4th Avenue Northwest. We're just a block east of St. Augustine's. And we'll also be doing the same thing next Monday, same time, same place, but then also Tuesday at HELPcare Clinic in Rochester. So they can go to our website at helpcare.health to get more information, or they can give us a call at 279-2345. And they don't have to just wait for the open house. They can come in during office hours too, and we'd be happy to show them around and talk. But we just did the open houses because people work during the day and maybe can't get away. This is a chance for them at their convenience to be able to stop by.
Yeah, and as people know, we're at that point in the year where we start this whole process all over with open enrollment on many plans. This is a great time to get together with our friends at the HELPcare Clinic, gather information, and make the best choice for you.
Absolutely.
Gentlemen, it's always a pleasure to talk with you. Look forward to visiting next month.